It's a pleasure to welcome back to Health Matters Dr. Adhd Ulzin, physician here at the University of Alabama Medical Center. Good to see you again, Dr. Ulzin. Thank you. We're talking about ADHD, Attention Deficit Disorder, that we hear so much about these days because it's, in the scheme of things, a relatively new issue that we've dealt with now for a few decades. And today specifically about adult ADHD. What is unique about this challenge for adults?
Okay. I think that maybe a few decades ago, nobody mentioned adult ADHD because there was a general belief that children who had ADHD did not have it when they grew up. But after a while, it became obvious that the majority of those children, probably about 2/3 of them, continued to have symptoms as adults, but the symptoms were kind of different from the symptoms they had when they were children.
So a child, we used to think, oh, they'll grow out of that.
Exactly.
I imagine that was a fairly common thing they would say.
That was the idea.
In fact, it's uncommon for you to grow out of it. You're going to deal with it. Do you then deal with it in a different way as an adult, or the challenges are just different?
Yeah, the challenges are different. So, for example, a child who is very hyperactive, as an adult, may have a lot more inner restlessness, but not so much obvious restlessness. So they still are restless, they feel restless, yes, though they might not disrupt other people.
And for a child, we might say, well, they have ADHD, they don't focus well in math, they're restless, they need to move around, they can't sit still. But for an adult dealing with issues, that can be a dangerous thing because of the adult things that adults do. Right?
Yes. But the symptoms seem to sort of migrate, let me put it that way, into adulthood. And they might become a little different from the way people presented when they were children. So people may see them as being more difficult to deal with rather than a talkative child. He may be a more provocative adult, maybe, you know. So very often it's a disorder that's misdiagnosed in adults as a personality problem if they didn't know that they had it as a child, or they may have anxiety with it, and when they're older, you see more of the anxiety than the ADHD.
Do we know if adults with ADHD might be quicker to anger or
Yes.
not handle anger situations
Yes.
as well?
That is very, very much the case, because impulsivity is a very big part of ADHD, and when people do grow up, their impulsivity may be more manifested in emotional situations rather than physical situations.
When we go get a driver's license, they ask us several questions, but they don't ask if we have ADHD. No. You might think that might not be such a bad idea because it can play a role in safety. Is that right?
Yes. As a matter of fact, there is an increasing body of data about the difficulties people with ADHD have as drivers. They have about 4 times the citation rate, 4 times the accident rate as the general population. And there are quite a few studies now showing that when people are treated as adults, they're safer drivers, they're safer for themselves and safer for other people.
I'm assuming just like in children, the severity of ADHD is all over the place, from very mild to
Absolutely.
very, very severe.
Absolutely, yes.
What happens if it's very, very severe? Can it be so bad that an adult might not even be able to do basic tasks?
It can be. I mean, there are a lot of adults with ADHD, if they're fortunate enough to live in a big city where they don't have to drive, they just take the metro all the time. So you don't really realize that that's why they don't drive. Yeah. Yes.
But they might not be the best accountant
No.
out there, something that requires constant focus. Right. Let's talk about what we do about this. We know that when children are diagnosed, in many cases, maybe most cases, we find just the right medicine.
That's right.
And just the right amount of dosage of that medicine that seems to work. And I know there's an experimentation process involved in that. What do we do for adults? Is it similar?
It's very similar. I mean, most adults who had not been diagnosed as children, who then become diagnosed as adults, find that the medication transforms their lives. They tell us, wow, you know, I was able to drive to Georgia this time without having a problem, or I've been able to read a book from cover to cover for the first time. You know, those kinds of things we hear from adults who are treated. And they're treated very much with the same kinds of medications, just adjusted for the weight, body weight and things like this. Yeah.
Give us your expertise on any concerns about the medications. Some people, I don't like giving my kid those medicines because I don't think they're safe. What's the evidence?
Well, the reality is that we started treating ADHD with medications in the 1930s. So if you're looking for something that's been tried for as long as Adam, it would be ADHD medications. They're quite safe. There are a number of longitudinal studies, one in Canada, one in the US, looking at people who were treated from the 50s, so who are now in their 60s and 70s, and they're all very healthy. They have really no long-term side effects from the medication. So the data really doesn't support our anxiety about the medicines.
I didn't realize, and maybe our viewers didn't either, that we've been treating ADHD with medication since then. I always kind of think, well, they didn't even try to treat me. They probably just didn't think of doing that.
Well, the thing is that ADHD is what we call it now, but it had other names at that time.
Oh, what did they call it?
Earlier on, they called it minimal brain dysfunction.
Oh my.
You know,
almost treated like a hard and fast mental illness.
Exactly. You know, so it has been treated originally with benzodrine, and then later on dexedrine, and then now the more sort of modern versions of those medications.
And I think, was I correct when I mentioned the amount of medicine, dosage, is very critical to find that right?
Absolutely, which is a general principle in medicine.
Of any medicine.
That's
but
right.
In
That's
this, too much.
Too much can be a problem. I mean, it can have problems of maybe more excitation than a person might require. It might keep them awake at night. It might suppress their appetite. Those are sort of the more common ones. And if there is a family history of heart disease, we're a little more cautious about using stimulants, and we will use non-stimulant medications in those patients.
I'll make this my last question. The adult watching out here that thinks, you know what, I bet I could do my job better, or I bet I could read more if I pursued some guidance on this. Should they start with their general practitioner and say, who do you recommend I see? What would your advice
Yes,
be?
they can do that, and definitely there are very simple screening tools that a general practitioner could still use in their office to screen for the possibility that somebody has ADHD. And if they are positively screened, the commonest one is the WHO and the ASRS, then they can make a referral to a mental health professional.
Very good. We don't want a stigma attached to ADHD. It's manageable and something that you can help folks with.
It is very treatable, and really, when it's treated, it transforms people's lives.
You help us so much with your expertise and your time. We appreciate it so much. Thank you.
Thank you.
Thank you, sir.
It's been a pleasure. Thank you.